Question 1. A 75-year-old patient with a history of COPD presents with sudden onset of dyspnea, tachypnea, and confusion. The nurse suspects acute respiratory failure. What is the most critical first intervention? A. Increase the oxygen flow rate via nasal cannula. B. Initiate non-invasive positive pressure ventilation, NIPPV. C. Administer a bronchodilator. D. Obtain arterial blood gas ABG results. Answer. B. Initiate non-invasive positive pressure ventilation, NIPPV. Rationale. NIPPV is the preferred initial treatment in patients with acute respiratory failure due to COPD exacerbation. It improves oxygenation and reduces the work of breathing. While oxygen administration is necessary, NIPPV is more effective in this scenario. Question 2. A patient in the ICU with severe sepsis is receiving broad-spectrum antibiotics. Their blood pressure remains low despite IV fluid resuscitation. What is the most appropriate next step in management? A. Administer a vasopressor, such as norepinephrine. B. Increase the IV fluid rate further. C. Add a second antibiotic regimen. D. Prepare for mechanical ventilation. Answer. A. Administer a vasopressor, such as norepinephrine. Rationale. In severe sepsis, vasopressor therapy is indicated to restore perfusion to vital organs when hypotension persists despite adequate fluid resuscitation. Adding antibiotics and increasing fluids may be necessary, but vasopressors take priority to maintain organ perfusion. Question 3. A 60-year-old patient with a history of congestive heart failure, CHF, presents with acute pulmonary edema and oxygen saturation of 85%. Which intervention should the nurse implement first? A. Administer furosemide IV. Place the patient in a high Fowler's position. C. Start a continuous IV infusion of morphine. D. Administer oxygen via non-rebreather mask. Answer. B. Place the patient in a high Fowler's position. Rationale. High Fowler's position facilitates easier breathing by decreasing venous return to the heart, thus reducing pulmonary congestion. Administering oxygen and medications follows after optimizing the patient's positioning. Question 4. A patient who has undergone a major abdominal surgery is being monitored in the ICU. They develop sudden hypotension, tachycardia, and oliguria. What is the most likely cause? A. Acute myocardial infarction. B. Peritonitis. C. Hypovolemic shock due to hemorrhage. D. Pulmonary embolism. Answer. C. Hypovolemic shock due to hemorrhage. Rationale. Post-surgical patients are at high risk for hemorrhage, which can cause shock. The combination of hypotension, tachycardia, and oliguria suggests inadequate tissue perfusion, likely due to blood loss. Question 5. A patient is admitted with suspected neurogenic shock after a spinal cord injury. Which intervention is the nurse's priority? A. Administer IV fluids and vasopressors. B. Start antibiotics to prevent infection. C. Implement cervical spine immobilization. D. Apply warming blankets to maintain temperature. Answer. A. Administer IV fluids and vasopressors. Rationale. In neurogenic shock, there is a loss of sympathetic tone, leading to hypotension. Fluid resuscitation and vasopressors are necessary to restore blood pressure and maintain perfusion to vital organs. Question 6. A critically ill patient develops an arrhythmia and is unresponsive to medication. Which action should the nurse take next? A. Perform immediate defibrillation. B. Obtain an ECG and notify the physician. C. Increase the infusion rate of antiarrhythmic medications. D. Perform synchronized cardioversion. Answer. A. Perform immediate defibrillation. Rationale. Immediate defibrillation is necessary for life-threatening arrhythmias, such as ventricular fibrillation. Synchronized cardioversion and other treatments are used for different types of arrhythmias, but defibrillation is the first priority in this scenario? Question 7. A patient in the ICU is receiving mechanical ventilation after a motor vehicle accident. The nurse observes the patient's peak airway pressure is rising and the respiratory rate is increasing. What should the nurse assess for first? A. Pneumothorax. B. Endotracheal tube displacement. C. Increased secretions or mucus plugging. D. Pulmonary embolism. Answer: C. Increased secretions or mucus plugging. Rationale: rising airway pressure and increased respiratory effort often indicate airway obstruction, commonly caused by mucus or secretions. The nurse should first assess the airway for blockage before considering other complications. Question 8. A patient with a history of asthma is experiencing an acute exacerbation. The nurse administers a bronchodilator, but the patient's symptoms worsen. What is the next best step? A. Administer epinephrine IM. B. Start intravenous corticosteroids. C. Initiate mechanical ventilation. D. Perform a chest X-ray. Answer: B. Start intravenous corticosteroids. Rationale: when symptoms worsen despite bronchodilator treatment, systemic corticosteroids are indicated to reduce inflammation in the airways. Epinephrine and mechanical ventilation are reserved for more severe cases of anaphylaxis or respiratory failure. Question 9. In managing a patient with multisystem organ failure in the ICU, what is the most critical nursing intervention to prevent further complications? A. Maintain strict blood glucose control. B. Monitor electrolytes and acid-base balance regularly. C. Ensure adequate sedation and pain management. D. Position the patient to prevent pressure ulcers. Answer: B. Monitor electrolytes and acid-base balance regularly. Rationale: electrolyte imbalances and acid-base disturbances are common in multisystem organ failure and can exacerbate organ dysfunction. Regular monitoring and correction are essential to stabilize the patient. Question 10. A patient in septic shock develops acute kidney injury, AKI. What is the nurse's priority in managing this complication? A. Administer nephrotoxic medications cautiously. B. Monitor urine output and serum creatinine levels. C. Start dialysis immediately. D. Restrict fluid intake. Answer: B. Monitor urine output and serum creatinine levels. Rationale: monitoring urine output and serum creatinine is crucial to assess kidney function in septic shock. Dialysis may be necessary if kidney failure progresses, but early intervention involves careful monitoring. Question 11. A patient with a head injury is being monitored in the ICU. The nurse observes the patient's Glasgow Coma Scale, GCS, score decreasing from 15 to 9. What is the most appropriate nursing action? A. Perform a CT scan of the head. B. Administer hypertonic saline to reduce intracranial pressure. C. Reassess the patient's airway and breathing. D. Increase the sedation dose. Answer: C. Reassess the patient's airway and breathing. Rationale: a decrease in GCS score is concerning for worsening neurological status. The nurse should prioritize airway and respiratory assessment to prevent further complications, such as hypoxia or aspiration. Question 12. A patient with a tracheostomy tube is receiving mechanical ventilation. The nurse notices the patient has developed subcutaneous emphysema around the neck. What is the most likely cause? A. Pneumothorax. B. Tracheal rupture. C. Pneumonia. D. Airway obstruction. Answer: B. Tracheal rupture. Rationale: subcutaneous emphysema around the neck is often caused by a tracheal rupture, which can occur due to high-pressure ventilation or trauma. This is a serious complication requiring immediate intervention. Question 13. A patient is receiving continuous hemodialysis for acute renal failure. What is the nurse's priority in monitoring during dialysis? A. Monitor vital signs and fluid balance. B. Assess the arteriovenous fistula site for signs of infection. C. Observe the patient for signs of hypotension. D. Ensure the dialysate solution is warmed to body temperature. Answer. C. Observe the patient for signs of hypotension. Rationale. Hypotension is a common complication of hemodialysis and can lead to reduced organ perfusion. Continuous monitoring is essential to prevent and manage this condition. Question 14. A patient is admitted to the ICU with acute pancreatitis. Which assessment finding is most indicative of severe pancreatitis? A. Hypotension and tachycardia. B. Fever and chills. C. Abdominal rigidity and guarding. D. Elevated blood glucose levels. Answer. A. Hypotension and tachycardia. Rationale. Severe pancreatitis can lead to shock and organ failure, with hypovolemia causing hypotension and tachycardia. Abdominal rigidity may suggest peritonitis, but the systemic effects are most concerning in this scenario. Question 15. A patient develops acute pulmonary embolism in the ICU. Which of the following is the nurse's priority intervention? A. Administer oxygen therapy. B. Administer thrombolytics. C. Initiate anticoagulation therapy. D. Perform chest compressions. Answer. A. Administer oxygen therapy. Rationale. The priority in managing acute pulmonary embolism is to ensure adequate oxygenation to support tissue perfusion. Thrombolytics and anticoagulants are also important, but secondary to stabilizing oxygenation. Question 16. In caring for a patient with a severe burn injury, which is the most important intervention during the first 24 hours? A. Initiate fluid resuscitation with lactated ringer solution. B. Administer pain management. C. Apply antimicrobial ointments to the burned areas. D. Prepare the patient for skin grafting. Answer. A. Initiate fluid resuscitation with lactated ringer solution. Rationale. Fluid resuscitation is the priority in the first 24 hours to prevent hypovolemic shock and organ failure. Pain management and infection control follow, but do not take precedence in this critical early phase. Question 17. A 40-year-old patient with a history of hypertension presents with chest pain and elevated ST segments on the ECG. What is the nurse's first priority? A. Administer aspirin and nitroglycerin. B. Call for emergency cardiac catheterization. C. Start an IV infusion of heparin. D. Perform an immediate 12-lead ECG. Answer. A. Administer aspirin and nitroglycerin. Rationale. Immediate administration of aspirin and nitroglycerin is crucial in managing acute myocardial infarction STEMI. The goal is to reduce myocardial ischemia and prevent further damage. Question 18. A patient with traumatic brain injury is being closely monitored in the ICU. The nurse notices increasing intracranial pressure, ICP. Which intervention is most appropriate? A. Elevate the head of the bed to 30 degrees. B. Administer hypertonic saline. C. Increase sedation levels. D. Prepare for intubation. Answer. B. Administer hypertonic saline. Rationale. Hypertonic saline is used to reduce ICP by drawing fluid out of the brain tissue. Elevating the head of the bed is also important, but secondary to osmotherapy. Question 19. A patient in the ICU with advanced cirrhosis develops sudden confusion and drowsiness. What is the nurse's most likely priority action? A. Administer lactulose to reduce ammonia levels. B. Prepare for liver transplant. C. Administer sedatives to calm the patient. D. Perform a neurological assessment. Answer. A. Administer lactulose to reduce ammonia levels. Rationale. Acute confusion in cirrhosis is often caused by hepatic encephalopathy due to elevated ammonia levels. Lactulose helps reduce ammonia and improve mental status. Question 20. A patient in the ICU requires sedation. Which of the following sedative agents is most appropriate for preventing delirium in critically ill patients? A. Propofol. B. Midazolam. C. Dexmedetomidine. D. Ketamine. Answer: C. Dexmedetomidine. Rationale: dexmedetomidine is associated with less delirium and has sedative effects without causing respiratory depression. It is the preferred choice in critically ill patients who need sedation with minimal side effects. Question 21. A 60-year-old patient with diabetes and hypertension is admitted with acute decompensated heart failure. What is the nurse's priority intervention upon admission? A. Administer diuretics as ordered. B. Place the patient on continuous cardiac monitoring. C. Obtain a 12-lead ECG. D. Prepare for a coronary angiogram. Answer: B. Place the patient on continuous cardiac monitoring. Rationale: continuous cardiac monitoring is critical in patients with heart failure to detect arrhythmias and assess hemodynamic stability. Diuretics and other interventions follow based on the patient's condition. Question 22. A patient in the ICU is receiving intravenous IV sedation for mechanical ventilation. The nurse observes that the patient is becoming increasingly agitated. What is the first action? A. Administer additional sedation. B. Check the patient's oxygen saturation levels. C. Increase the ventilator settings. D. Check the IV site for patency. Answer: B. Check the patient's oxygen saturation levels. Rationale: agitation can be a sign of hypoxia or inadequate sedation. The nurse should first check oxygen saturation to rule out respiratory issues before adjusting sedation or ventilation settings. Question 23. A 70-year-old patient is admitted to the ICU after a stroke. Which assessment finding is most concerning for possible complications? A. Dysphagia. B. Nausea and vomiting. C. Hemiparesis. D. Sudden onset of headache. Answer: D. Sudden onset of headache. Rationale: a sudden, severe headache in a stroke patient may indicate increased intracranial pressure or a recurrent stroke. Other findings like dysphagia or hemiparesis are expected after a stroke, but are less immediately concerning. Question 24. A patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with acute respiratory distress. The nurse is preparing to administer a bronchodilator. What is the most important consideration? A. Administer the medication via nebulizer. B. Ensure the patient is sitting upright before administration. C. Monitor for adverse effects, such as tachycardia. D. Administer oxygen prior to bronchodilator administration. Answer: C. Monitor for adverse effects, such as tachycardia. Rationale: bronchodilators, especially beta agonists, can cause tachycardia and other cardiovascular side effects. Monitoring these effects is essential to prevent complications, particularly in patients with pre-existing heart conditions. Question 25. A patient with suspected septic shock is being treated with broad-spectrum antibiotics and fluids. What is the nurse's next priority action? A. Start vasopressor therapy. B. Obtain a lactate level. C. Perform a complete blood count, CBC. D. Perform an ultrasound to assess fluid status. Answer: A. Start vasopressor therapy. Rationale: in septic shock, if the patient remains hypotensive despite fluid resuscitation, vasopressors are necessary to restore perfusion. Other tests like lactate levels or a CBC are important, but secondary to stabilizing the patient. Question 26. A patient in the ICU is receiving blood products for severe hemorrhage. Which intervention should the nurse prioritize to ensure the safety of blood transfusion? A. Monitor the patient for signs of an allergic reaction. B. Obtain vital signs every 30 minutes. C. Verify the blood product with another nurse before administration. D. Administer a diuretic to prevent fluid overload. Answer: C. Verify the blood product with another nurse before administration. Rationale. The verification of blood products with another nurse is a critical safety step to prevent transfusion errors. While monitoring for reactions and other actions are important, correct identification of blood products is the first priority. Question 27. A patient with severe burns is receiving fluid resuscitation. The nurse notes that the patient is becoming increasingly restless and has a urine output of 15 milliliters per hour. What is the next step in management? A. Increase the IV fluid rate. B. Administer pain medications. C. Administer a diuretic. D. Call the physician to assess for compartment syndrome. Answer. A. Increase the IV fluid rate. Rationale. The patient's decreased urine output and restlessness suggest inadequate fluid resuscitation, which is common in the initial 24 hours after severe burns. Increasing the fluid rate is necessary to optimize perfusion and kidney function. Question 28. A critically ill patient develops elevated intracranial pressure, ICP. Which nursing intervention is most appropriate for decreasing ICP? A. Administer mannitol to reduce brain swelling. B. Elevate the head of the bed to 45 degrees. C. Administer hypertonic saline. D. Keep the patient in a flat position to improve venous return. Answer. A. Administer mannitol to reduce brain swelling. Rationale. Mannitol is an osmotic diuretic used to decrease ICP by drawing fluid out of the brain. Elevating the head of the bed is helpful, but secondary to pharmacologic intervention. Question 29. A patient undergoing dialysis presents with hypotension and dizziness. What is the nurse's most immediate priority? A. Increase the dialysate temperature. B. Administer a fluid bolus. C. Slow down the dialysis rate. D. Assess the patient's cardiac status. Answer. B. Administer a fluid bolus. Rationale. Hypotension during dialysis is often due to fluid removal. Administering a fluid bolus can help to stabilize the patient. Slowing the dialysis rate and other interventions may be necessary later, but fluid replacement is the first priority. Question 30. A post-operative patient develops sudden shortness of breath, tachycardia, and chest pain 3 days after surgery. What is the nurse's most likely concern? A. Pulmonary embolism. B. Pneumothorax. C. Pneumonia. D. Acute coronary syndrome. Answer. A. Pulmonary embolism. Rationale. The sudden onset of shortness of breath, tachycardia, and chest pain in a post-operative patient is highly suggestive of a pulmonary embolism, especially within the first few days after surgery. Question 31. A patient with liver cirrhosis presents with confusion, asterixis, and asterixis. What is the most appropriate intervention to treat hepatic encephalopathy? A. Administer lactulose to reduce ammonia levels. B. Start an intravenous IV antibiotic regimen. C. Administer diuretics to reduce ascites. D. Initiate steroid therapy to reduce inflammation. Answer. A. Administer lactulose to reduce ammonia levels. Rationale. Lactulose is used to lower blood ammonia levels, which cause hepatic encephalopathy in cirrhotic patients. Antibiotics, diuretics, and steroids may be required later, but lactulose is the priority for treating encephalopathy. Question 32. A patient is experiencing an acute asthma exacerbation. After administering a bronchodilator, the nurse should next assess which of the following? A. Oxygen saturation levels. B. Breath sounds. C. Respiratory rate. D. Arterial blood gas ABG results. Answer. B. Breath sounds. Rationale. After administering a bronchodilator, assessing breath sounds is crucial to determine the effectiveness of the medication. While oxygen saturation and respiratory rate are important, breath sounds provide direct insight into airway patency. Question 33. A patient admitted with suspected acute pancreatitis is showing signs of hypovolemic shock. What is the first action the nurse should take? A. Administer a bolus of normal saline. B. Administer analgesics to control pain. C. Start an intravenous IV proton pump inhibitor. D. Prepare the patient for an ultrasound. Answer. A. Administer a bolus of normal saline. Rationale. Hypovolemic shock in acute pancreatitis is usually due to third spacing of fluids. Fluid resuscitation with normal saline is the priority to restore circulating volume and prevent organ failure. Question 34. A patient develops acute kidney injury, AKI, in the ICU. Which laboratory value would the nurse expect to be elevated? A. Sodium. B. Potassium. C. Albumin. D. Calcium. Answer. B. Potassium. Rationale. Potassium is elevated in AKI due to impaired renal excretion. Other laboratory values, such as sodium or calcium, may not necessarily be affected in the same way. Question 35. A 50-year-old patient with sepsis develops delirium. What is the most important nursing intervention to address this complication? A. Ensure adequate sedation. B. Monitor for hypoxia and correct as needed. C. Administer antipsychotic medications. D. Place the patient in a quiet, dark environment. Answer. B. Monitor for hypoxia and correct as needed. Rationale. Delirium in septic patients is often secondary to hypoxia or other metabolic disturbances. Ensuring adequate oxygenation is the priority intervention. Sedation and other treatments follow based on patient needs. Question 36. A 60-year-old post-surgical patient is developing signs of deep vein thrombosis, DVT, after surgery. What is the nurse's most appropriate priority action? A. Administer anticoagulation therapy. B. Elevate the affected leg. C. Prepare for an ultrasound of the leg. D. Assess for signs of pulmonary embolism. Answer. B. Elevate the affected leg. Rationale. Elevating the affected leg is a priority to promote venous return and reduce swelling. Anticoagulation therapy and other interventions follow after the initial management. Question 37. A patient receiving mechanical ventilation is being weaned off the ventilator. The nurse notices increased work of breathing and decreased oxygen saturation. What is the next step? A. Administer a bronchodilator. B. Reassess the ventilator settings. C. Increase sedation. D. Resume mechanical ventilation at a higher level. Answer. D. Resume mechanical ventilation at a higher level. Rationale. When signs of respiratory distress appear during weaning, it is important to return to mechanical ventilation at a higher level to support the patient. Other interventions may be needed afterward. Question 38. A patient is admitted to the ICU with suspected acute myocardial infarction, MI. The nurse notes ST segment elevation on the ECG. What is the priority intervention? A. Administer aspirin and nitroglycerin. B. Call for emergent cardiac catheterization. C. Administer a thrombolytic agent. D. Initiate IV heparin therapy. Answer. B. Call for emergent cardiac catheterization. Rationale. The priority in STEMI is emergent coronary angiography and possible percutaneous coronary intervention, PCI, to restore blood flow. While medications like aspirin and nitroglycerin are important, catheterization is the priority. Question 39. A patient who has undergone spinal surgery in the ICU is showing signs of autonomic dysreflexia. What is the first nursing intervention? A. Raise the head of the bed to reduce pressure. B. Loosen any tight clothing or restraints. C. Administer antihypertensive medications. D. Notify the physician immediately. Answer. B. Loosen any tight clothing or restraints. Rationale. Autonomic dysreflexia is a life-threatening condition, and the first step is to identify and remove any noxious stimuli, such as tight clothing or restraints, which can trigger the episode. Question 40. A patient in septic shock is developing oliguria despite adequate fluid resuscitation. What is the nurse's next priority action? A. Start an inotropic agent to improve cardiac output. B. Increase the fluid resuscitation rate. C. Initiate renal replacement therapy dialysis. D. Administer vasopressors to restore perfusion. Answer: D. Administer vasopressors to restore perfusion. Rationale: if a patient with septic shock is not responding to fluids, vasopressors are necessary to restore organ perfusion. Renal replacement therapy may be required later, but vasopressors take priority. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!